My name is Samuel Sane from Kenya, representing Africa. I'm here at KIMS, my favorite hospital. I'm an ex-patient here, and today I have a special doctor I would like to introduce to you. My good friend, Doctor.
Hello, I'm Dr Yashaswi. So I'm a consultant urologist and andrologist. So an andrologist is the one who specializes in the disease of penis and erectile dysfunction, any sexual diseases.
Yes.
Okay. So I treat the male sexual disorders and also the erectile dysfunction and infertility. So we deal all kinds of diseases related to the men's health.
Related to men's health, only men.
Men's sexual health.
Good. Okay. That is the department of andrology.
Andrologist.
What about urologist?
So urology, we deal with the disease of kidney, ureter, bladder and penis, and also the strictures of urethra. Like if you have any problem with the flow of urine,
yes,
there may be block at the urethral level, there can be a block at the prostate level,
yes,
so which is called benign prostatic hyperplasia.
Yes.
So we deal with the problems like that, and we also deal with the cancers related to the kidney,
yes,
ureter and bladder and penis.
And also prostate maybe?
Yeah, prostate, definitely. Prostate.
What if in case someone has a damaged urethra? What do you do? Such cases?
They are depends upon the situation actually. You know, it depends upon the length of the defect. Normally the urethral length is 20 to 25 centimeters, and we will do a test called RGU, retrograde ureterogram. So where we measure the length of the defect, and based on that we will decide whether to do a endoscopic operation or a open operation. Endoscopy is there is no incision.
Yes.
We will go through a camera through the urethra,
yes,
and we will, whatever the defect is there, we will repair that,
yes,
and we will keep a urethral catheter for 5 days and we will remove that. After that, then the patient will be fine.
How long have you been in this specialty?
It's been my 5th year of my specialty.
5th year.
5th year.
And how many patients have you treated so far?
I think it's a big number maybe, because the previous day I used to work in Chandigarh. There we have a lot of number. I think more than like 2,000 patients.
So your mind is thinking only settling men's issues, problems, diseases.
Yeah.
And you're happy about it. Now my question is this: what are the most complex men diseases related to the sexual organs?
The most common disease for any man in the earth is erectile dysfunction. Because one...
We call it ESD, function.
Erectile dysfunction. ED. Short form ED.
ED.
So ED means erectile dysfunction. What does it mean? The patient, the penis will not be erect fully.
Yes.
So because of that, the man cannot perform a sexual act.
Yes.
He cannot do an intercourse with a woman. So that is called erectile dysfunction, and it is mostly common in age people above 50, and in the patients who have diabetes, hypertension, and some patients with who have taken steroids for the bodybuilding and the gym and like that.
Yes.
So this is common in those type of men, and it is treatable.
How do you treat?
First of all, there are two modalities of treatment: the medical therapy and surgical therapy. In medical therapy, we give some tablets to increase the blood flow to the penis. Thereby, the strength of erection will be increased, so that the man can perform sexual act.
Yes.
And who cannot perform a sexual act with the medicines, then we give them a option of surgical therapy. Surgical therapy, we place implants, which is called penile implant.
Yes. Do you have such kind of implants here? You can show you people.
Yeah, we have two types of implants. One is a rigid malleable implant, and the second is the inflatable implant.
Inflatable.
Yeah. So malleable implant is simple. It's like a rod-like structure. It's made of silicone material. So we place there are two rods in the penis, which we call cavernosa, which are main for the erectile function.
Yes.
So what we do is we place the implants in that cavernosal space.
Yes.
So that when the man wants to perform a sexual act, the penis can be erected and he can perform sexual act.
And also relax when the act is over.
No, it depends upon type of implant. As I told you before, there are two types of implant: inflatable, rigid. Rigid you cannot deflate. It is always erect in erect state.
Yes.
But that you can bend the penis when you are not performing sexual act. So normally the penis will be erect if you want to perform sexual act. When you are working on in a daily life, you can just bend the penis down. But the inflatable, which is actually, it mimics a natural erection.
Yes.
When you want to perform a sexual act, there is a button in the inflatable implant.
There is a special button.
When you inflate the button, and the implant engorges because of the fluid inside, and the penis becomes erect. And when you shut off the button, the fluid goes back, and the penis will be in a non-erectile state.
That's great. I've never heard of this before, and it is good for men who think it's
Definitely.
over with them.
It is like the rebirth for your sexual life.
Yeah. You know, for a man, the man's joy is to feel good. So if you don't have an erecting penis, then
see, sex is,
it also pulls your esteem down.
Yeah. Because see, sex is not just a act in your life to produce children. It is needed in your daily life. It also increases your confidence in a daily work. See, not able to perform a sexual act, it causes a depression, and you won't believe some people have suicidal thoughts because of not performing a good sex.
True.
And there could be a divorce also, because the female may accuse the men that not potent, so there will be a divorce issues also.
True. I agree with you.
So for those men who are not able to perform sexual act because of erectile dysfunction, this implant is very good.
Which any other disease that it's complex in this kind of situation in men?
I think
any other disease that it's complex apart from erectile dysfunction?
Stricture urethra.
Stricture urethra.
The block in urethra because of a trauma, anything. If we are not able to treat with endoscopic method, which I said you before, we have to do an open surgery, which you call as urethroplasty. So urethroplasty, we use a graft from the buccal mucosa, and we use the graft to create a new urethra. So that the patient can can pass urine freely
without struggle. That's good. There is this other issue of men infertility. How do you handle this case?
Men infertility is the cause of infertility is very diverse. But at the end of the day, what matters for us is whether to make a man to have a baby or So first of all, whenever a patient comes to us with the issues of infertility, we first send a semen culture or semen analysis. We will look upon how many sperms are in the semen, and depends upon the count of sperm and the type of sperm. Then we give the advice what to do next. If the sperm count is very low or undetectable, then we advise for the ICSI, which you call IVF, in vitro fertilization. If the sperm counts are in a borderline level, it's not very low, it's not normal also, then we can advise IUI, intrauterine insemination, where we took the we will take the sperm, we will process it, and we will take the good sperm and we will directly inject into the partner's uterus. If we are not able to, we will give 2 or 3 cycles of IUI. Intrauterine insemination. And if the patient still was not able to get a baby, then we advise ICSI, what we do is we take the sperm under microscope and we inject the sperm directly into the partner's ovum, so that we will form is like test tube baby, what you call is test tube baby. Test tube baby.
Is there any medicine to boost sperm count?
There are definitely medicines, but they are partially success. It's not like if you have less sperm, you take the medicine, it will not be like a good sperm they will be like 10% effective. But the thing is that you can correct some of the factors that are causing this decreased sperm level. Like if you have varicocele, because of which the sperm level is going down, you can correct the varicocele. If you are having some diabetes, or if you are obese, you can correct those factors to increase the sperm quality and counts. So there are some correctable factors which you can.
So the best thing is patient to see the doctor immediately without delay.
And also the important thing is the age of the patient.
We
will get the best results less than if the male is less than 40. And we also should see the age of the female also, because in any infertility case, both the male factor, female factor, we have to treat at the same time. We can't say that the infertility is due to only one partner. It is always the both partners. You have to take into picture and treat them both.
Another question: how do you treat this common problem known as premature ejaculation?
Premature ejaculation is more of like a psychological issue rather than a organic issue, because it mainly involves the anxiety. rather than that. But normally we have some many medications as of now.
Yes.
Most common we use a depoxetine 30 mg.
Yes.
And there are some local sprays also where you can have to spray some anesthetic like solution on your glands penis. So it decreases sensation so that you can perform longer. And most important, we prefer counseling and some small medications. And this is a small thing that will be getting settled.
Okay, that's good. There's also another issue known as testicular torsion.
Yeah. See, what happens is in testicular torsion, it happens in mostly in young individuals, like between the ages of 15 to 25. So what happens is the vascularity, the blood vessels which are supplying the testes, they get twisted out.
Yes.
Because of the twisting, the blood supply is cut off for the testes.
Yes.
And it's a very emergency situation. If you don't come to a doctor within 4 hours, we may not able to save the testes.
Yes.
If the patient comes to us within 4 to 6 hours, then there is a chance that we were able to save the testes.
Yeah. So at what age does it happen? The what you call the torsion itself. At what age?
It happens between ages of 15 to 25.
Age of 15 to 25.
Yeah, young
it's
adults.
Good for, it's good for men to know this.
Yeah,
and mostly definitely. Young boys.
Any sudden pain in testes, definitely see a doctor. Because as I told you, if you come to us within 4 to 6 hours, then only we will be able to save the testes.
Yes.
If the torsion happen, you come after 24 hours, we can't save the testes when we have to remove the testes.
Good.
Yeah.
Another disease, phimosis.
Phimosis is unable to retract the skin. So whenever when you have your penis, you see that the upper skin, right?
Yes.
So some people may not be able to retract the skin back. It may be because of infections.
Yes.
It may present since birth also for some patients, and it may be due to some trauma also. So what we do is a circumcision for these patients.
Yes.
The circumcision is like open circumcision, stapler circumcision, and laser circumcision. We have all the facilities available with us.
Good. Now, do you recommend circumcision of men?
For everyone?
Yeah, for everyone. For men?
For men, it is a personal choice, but definitely circumcision has its own benefits. It decreases the number of urinary tract infections due to sexual intercourses. It decreases the risk of penile cancer. Because normally in men who are uncircumcised, the risk of penile cancer is considerably high compared to who are circumcised. So circumcision definitely decreases the risk of penile cancer and sexually transmitted infections.
Good. In Africa, if you're not circumcised, you feel you're low, you have low esteem.
In general, circumcision is good.
Good.
Definitely.
It's good to advise people about this.
Yeah, getting circumcision is never bad.
That's true. The main issue here, we have this major problem in Africa. I don't know what about in India. I've heard of it in European countries and also Western countries. Prostate cancer.
Yeah. See, prostate cancer, it is actually a cancer of rich people, to be frank.
Why do you say prostate cancer is for rich people?
I'll explain this. Because I'll explain this because it is detected because rich people have facilities more facility to reach the health care sector. So they are detected in those people. It's not like that there is no difference.
Yes.
But the poor and below middle class, they don't get that regular health checkup, right? So that is detected less. The incidence is not different, but the reporting is different.
Yes.
The reporting is more in the rich people because they get to get health checkups in regular basis. So they are detected more in these people.
Yeah, than poor people.
Rather than there is no difference in any population will have similar amount of incidence in the prostate cancer.
Yes.
But the prostate cancer is very slow growing. And if you are detected within a good time, you can be treated with fully. You can get rid of cancer with 100%.
Yes.
And we have a robotic prostatectomy done here, and with that we can guarantee 100% cure.
I've heard of people saying that sex prevent prostate cancer. Is it true?
No. There is very different opinion actually on that. It doesn't. See, the prostate cancer mainly because of your genetics.
Yes.
If the father has a prostate cancer, there is a 50% chance that the son will have a prostate cancer.
So it can be genetic.
Yeah, it can. It is genetic in most of the cases.
Most of the cases.
Yeah, it is genetic. Sex is. See, there are different. Various studies shows that some studies show there is a risk. Some studies show that there is a preventive effect, but there is no much difference.
Okay. It's good to know some of these things. They are on social media. They are everywhere. It's good to know. Also, educate our people.
Yeah, definitely they should know.
Okay, my last question to you. Do you have supportive or assisting equipments that make your work easier as a doctor? Medical equipments, like I've seen this machine known as Da Vinci.
Okay, the robot.
Robotic
Yeah,
assisting machine.
see, in urology, almost all of the cases can be done open or laparoscopy very easy. But only the prostate cancer, coming to radical prostatectomy, which we use for prostate cancer, that robot has changed the entire scenario. In the last 20 years, before that, doing a prostatectomy is very different. Before the robot came into the picture, it's very difficult, because the prostate is in deep inside. It's not easy to gain the access. And even though if we gain access, the surgery is not so fine. But after the advancements in the Da Vinci robotic system, the prostate cancer is it's like a piece of cake. The doing surgery is like playing a video, video game, or it could be it's very easy. It became lot easier for the urologist to treat the prostate cancer with the advancement of robotics.
Does it give you the best success rate?
Yeah, definitely.
Than doing
open. Yeah, definitely. Because you can do both the lymphadenectomy and the prostate cancer, radical prostate, same sitting. So definitely the results are good. And even there is no incision. There is a small 1 centimeter incision. We'll have 3 incisions of 1 centimeter. Before that, there is a long incision of 10 centimeter. So the incision which we used to give is smaller. So the post-op pain is less. The patient can go home quickly, and there is no intestinal complications. And the recovery is very fast. Instead of 10 days of hospital stay, now after robotic surgery you can discharge in 3 days. Yeah,
that's great. I would like you to speak something to our people, Africa. Tell them something about what they should do once they feel they're sickly, and mostly our men.
See, I want to advise about 2 things. All the men above 45 to 50 years group, get checked for a PSA, prostatic specific antigen for prostate cancer. And if the PSA level is high, immediately consult a urologist. And don't consult general physician because they may not having much idea about the prostate cancer, so consult a urologist. And second thing, for the male men who are not able to do sexual intercourse properly because of erectile dysfunction, definitely there are good treatments, and we do a lot of penile implants. So with the penile implant, the sexual life can be restarted, and these penile implants have a good 100% success rate, and you can really enjoy your sexual life after that.
Good. Thank you so much, doctor.
Thank you.
Hoping to see you with patients who are suffering this condition. And we hope for the best.
Yeah.
Thank you.
Thank you.
Wish you the best.
Thank you.
Thank you.